patients are a mix of all kinds. A lot of retirees, so we see a lot of Social Security, Medicare patients. We have a lot of poor people in this community, and they come to this clinic too. And, well, Caucasian patients, a lot of Hispanic patients, and we have a lot of people who, 40% maybe, who have no insurance. So we see them. We're the provider of last resort.
And one of our missions here in the county is to serve the uninsured and underinsured population. So we have a mix of patients that have Medicare, Medi-Cal, which is Medicaid here in California, and then a variety of different types of patient assistance types of programs, and as well as our self-pay patients.
So we have some highly educated patients who know how to use the internet and, the whole gamut if they want to research. We also have down to the patients who speak other languages other than English, and a lot of them do have some education deficiencies.
Financial is the biggest, but also there are stressors, psychological stressors.
There is one patient that actually broke my heart because he had recently had half of his foot amputated because his sugar was so high. And then we asked what was going on, and he said, well, I don't have the money to afford medications.
Part of good diabetes care includes an eye doctor to see them once a year. But if they have no insurance, then we usually then have to refer these people up to the main county clinic, which is up in Santa Barbara, which will require them to either drive up there or take 2 buses. People, we make appointments, they don't always go because of that.
So we're finding that most people are illiterate, and that impacts our way of educating them. Sure.
Also with those patients that are usually of the lower education, they also have some stigmas they have on diabetes and some old-time remedies they think help. Like one patient was telling me about eating bird's feet helps decrease the blood sugar, and that's what they do in Mexico when he goes back there. So.
And I can tell you that we have many patients that have improved a lot. They have improved a lot with diet. I see it in their hemoglobin's A1C. They actually go down 2 points, from one visit to another. And their weight, goes down. And when they come here, they're happy. Just by me, getting there on the scale, and when they see the difference, oh my God, I lost this many pounds, they do get really excited.
One of the most surprising things that I discovered was that patients weren't being honest with their physician about their compliance because they want to make the physician happy with them. So instead of saying, well, you haven't been taking your medication, I can tell from the pharmacy, why aren't you taking your medication? I came up with, I see it's been hard for you to take your medication. Is it hard for you to afford your medication? Is there anything that we can help you with? And the patients would start to open up, and it's like, yeah, I can't really afford it, and I need the money for food, or I'm able to look at their medication, and so I was able to recommend therapeutic changes for the physician to help the patient afford their medication.
If you're going to provide patient care, the bigger picture that you have, the better the care that you'll be able to provide. So for a pharmacist to be able to see a clinic and to be part of a clinic and to be able to be part of the entire process of patient care, I think it's got to be eye-opening.
I'm sure they want to make a difference in their life, So if we could have a class to teach them using money to prevent rather than to treat, which is worse, that also will be amazing.
I think this model of care, having a pharmacist, the doctor, and the dietitian all working together is absolutely fabulous. I love it. I'm being totally honest. I'm not just saying for the camera. I think it is absolutely wonderful.
It's clear to us, and I think clear to almost all physicians, that they can no longer manage a patient's care independently. They need multiple resources, more active participation of pharmacists in medical care. That would be great, particularly in the context of this team setting. I think when there are active participants of a center-based team, it just it's just no question, it's a tremendous benefit.